Dental implants are an effective and viable option today that is available for replacement of teeth, where you are looking at long-term success rates and a long-term treatment plan, a permanent treatment plan for that matter. But not always is it possible that dental implants will be possible to be done in all the patients. It depends on the bone quality, the quantity that is available for doing dental implants also. And that are times where we might go ahead and do other treatment options. And one such patient came to us where she was already having a denture, a removable denture made for her. Medically, she had an history of arthritis where she was taking steroids initially for a brief period. She had already been on steroids, and she was told that she has osteoporosis, because of which dental implants was not given as an treatment option for her, and she was wearing a denture for quite some time.
एक्चुअली मुझे दांत का बहुत प्रॉब्लम हो गया था। मैं आर्थराइटिस पेशेंट हूँ और रूमेटॉइड आर्थराइटिस बोला तो कहीं भी कोई भी जॉइंट पकड़ता है। 35 इयर्स से मैं स्टीरॉइड ले रही थी और अभी जब दांत मेरे ख़राब होने लगे, ऊपर के सब दांत ब्रिटल होके सब टूटने लगे, मुझे निकलवाने पड़े।
She ideally came to us for replacement of her lower teeth, where she had missing lower teeth, and that was giving trouble in biting. And that is where what we suggested her is we will start with your dental implant therapy first for the lower teeth which are missing. Let's go ahead with that. Let's see the success there. And then we think what can we do for the uncomfortable denture that you have.
और निकलवाने के बाद मैं डर रही थी फिक्स टीथ के लिए। इम्प्लांट का सुना था, लेकिन डर लग रहा था कि जो हाथ पैर सब शेपलेस हो गए मेरे आर्थराइटिस की वजह से, तो वो बोन में स्क्रू बैठेगा या नहीं, या कैसे क्या होगा पता नहीं था।
The first thing was to check how her bone behaves when we start with the dental implant therapy, and that is why we first decided let's just do 2 implants for your lower missing teeth and first replace the lower teeth as such. And we started with her treatment. The surgery went well, and in the next 3 months the bone healed very well.
पहले तो लोअर टीथ मेरे जो खराब हुए थे वो हम लोग ने इम्प्लांट करवाए और उसके बाद मुझे ठीक लगा।
And we could replace the lower teeth with dental implants very easily. Now was the time when we suggested her, now let's take into consideration the upper arch also for dental implant.
वो सक्सेस होने के बाद मुझे थोड़ा कॉन्फिडेंस भी आया कि अभी मैं अपर टीथ के लिए अगर इम्प्लांट ये बोल रहे उस तरह कराती हूँ तो मेरा हमेशा का ये तकलीफ कम हो जाएगा, मेरा प्रॉब्लम चला जाएगा।
And then what we did was we went ahead and did her scans. Now when we did the scans for the upper arch, we realized that the amount of bone available is really less, because she might have lost most of her teeth quite early, and it might be around I think 8 to 10 years that she was with those missing teeth, and because of which the bone also had shrunken quite a bit. And that is where the amount of bone availability was a challenge now. But thanks to the newer technologies that are available, see, there are a lot of options available now. Even when the bone quality or quantity is less, there is a lot that can be done. Especially what we suggested her was to do something which is called an all-on-4 implant procedure, where we would do only 4 implants for her upper arch. But even for that, the amount of bone availability was really less. The bone was too thin. So what we had suggested is, in these areas we will do some grafting procedures, and we will also expand the bone there when we are doing the process in itself. It won't be as simple as we did her lower arch, but we still were confident with the technology that we had, and with the advent of newer implants, which are right now we are using Straumann BLX implants, which are really active and which have a very beautiful design where we can actually compress the bone, expand the bone, collect the bone, everything happening at the same time because of the thread design that the implant in itself has. We did all the 3D plannings on the software that we have, and once that was done, it was decided to do a surgical guide for the patient, which obviously in ProCare we do it in-house only. And this guide specifically, we made sure it is going to be a bone level guide. And once the guide was made, we planned for the surgery. Everything was well planned, and she came early morning for the surgery. We started the surgery. It went really well and really smooth.
परमानेंट जो लगाया डेंचर, उसके बाद मुझे बिल्कुल भी नोसिया फील नहीं होता। जो मेरा प्रॉब्लम था वो सॉल्व हो गया, और हर वक्त डेंचर निकालो, साफ करो, वो झंझट में से भी मैं छूट गई।
And once that was done, we converted her denture the same day, and we gave her that same denture was converted to a fixed temporary prosthesis. Imagine, with grafting, with everything happening there, but still we could give her good temporary fixed teeth on the same day. And suddenly the plate of the denture palate was gone, and she was already feeling so comfortable the next appointment that we saw her.
वो जाने के बाद मुझे बहुत सोशल लाइफ में भी फ़र्क आया, स्माइल में, बोलने में, हर तरह से मुझे फ़र्क आया, और च्यू करती हूँ, अच्छे से खाती हूँ सब। तो उसकी वजह से मुझे जो गैस होता था, पेट का हमेशा तकलीफ रहता था दांत की वजह से, वो सब गया।
Then the temporary fixed teeth remained there for 3 months while the healing was happening. We still delayed it a little more, maybe around 3.5 months. We again went ahead, we did her x-rays, and we found that the healing was really good, and we decided to convert that into the final prosthesis again with the temporary already in place. What we just did with the digital technology that is available nowadays, you can mimic the same temporary prosthesis, that the bite and everything that is already the patient has been so much comfortable for the 3-4 months that you have. We converted the same into with the CAD designing, we converted the same into a interim check that we did with the acrylic prosthesis. And once the acrylic prosthesis was all okay in bite and everything, the same design was then done into zirconia, and we could give her zirconia fixed prosthesis. We recently finished the case and it went absolutely fine. Imagine the fixed prosthesis, the final fixed prosthesis took us just 15 to 20 minutes of time.
तो थैंक्स टू प्रतीक एंड हिज टीम, उन्होंने बहुत अच्छे तरीके से और इतने कॉन्फिडेंस के साथ ये काम किया, इतने प्लानिंग से किया।
It gives us so much happiness looking at happy faces and happy smiles, and so many blessings that we get from doing these procedures. So I would recommend people to go ahead, get dental implant treatments done today and get fixed teeth for yourself.